right, Jessica, thank you very much. It's a good subject. We want to talk about it right now. And joining me is my guest tonight, and it's Dr. Sabrina Magid-Katz, a Westchester dentist. Nice to have you here, Sabrina.
Thank you for having me.
Yeah, you know what? I think it's important, and you're going to tell us now, to have an early positive experience visiting the dentist, right?
That is very true.
Sure.
It's important to establish a relationship with the dentist as soon as that first tooth comes in.
Yeah.
So if something happens, you can know where to run to. But it's also important when they're about 3 to really get the kid involved. We have a whole generation of patients that never know from dental anxiety.
So I'm sure that you sit and you talk to these young patients and anybody else who comes in and make them feel a little more comfortable?
Yes, I have patients that come in as kids. They're already afraid, but they wind up, they want to be a dentist now. And that just is the highest
That's
compliment.
very nice. It's a good compliment. A lot of changes, too, have taken place. I know that, you know, lasers and things like that have changed all that sound of the drills and everything. That's very important. That's very positive, too.
It a long way. A lot of the phobia is stemmed from the sound and the fear of pain, the fear of a needle. With things like lasers and air abrasion, like sand and air, people can experience a cavity being filled without the numbness, perfectly comfortable, without the noise. It's amazing. And again, these kids don't know from the anxiety.
No, and Dr. Katz, we were just talking about, you know, some of their other serious issues, aside from, you know, decay and losing a tooth and so forth. But there are important health issues that we did touch on. But I want you to elaborate a little bit more in terms of why that's so important to see the dentist and problems that could arise that you don't know about.
Of course. So as they mentioned, we're always looking for oral cancer. And we have ways of doing that and finding things earlier. But we also find that infection and the bacteria that causes gum disease and other problems can be related to high blood pressure, stroke, diabetes, all these other effects on your whole body.
And I think it's also important to point out that, you know, this anxiety thing, a lot of people today are doing social media, right? Selfies and so forth, want to have a nice smile, okay?
Of course. So many people are getting cosmetic surgeries of all kinds of types for selfies. And when you think about dating apps, and you have one quick chance to swipe left, swipe right, Match.com actually did a survey, and they found that the smile is the first thing people look at and the most important.
Well, there's a lot going on there. Dr. Katz, we appreciate you being here today, sharing some good information with us, too, okay?
Thank you so much.
Nice smile.
Yes.
Okay, thanks a lot.